I get deep pain, soreness, and stiffness in my lower back, L5 or even SI joint, while bending. Does this sound like SI joint instability? What do you recommend in terms of exercises to focus on? The most obvious indication of SI joint pain is the location of the pain. A lot of people are going to have pain in this region here, which is above the pelvis. You can see the pelvis right there. That is the attachment of the muscles to the edge of the pelvis bone. So that's the pelvis. And a lot of people are going to get pain out just right above that in this region. And that's going to be lower back pain, L5, S1, or L4, L5. But SI joint pain is going to be a bit lower. It's going to be like right here on one side or on the other side. Not usually on both sides, but it can be on both sides. This is the back of the body here. Where I was just pointing for SI joint pain was right about there. There's a big knob that you can feel with your hands. You can feel on your back. If you don't have too much soft tissue covering it, you can feel a bony knob to the side of your spine down low. That's right here. So SI joint pain is just going to be right next to that or on the other side. Okay, so that's very clear indicator of SI joint pain. Most people that have lower back pain are going to be feeling it a little bit higher. It could be more diffuse, more widespread, up higher. Okay, so there is a few inches or at least a couple inches difference in height, and then the SI joint is also going to be to one side or the other. The solution to both of these issues is very similar. There's a lot of overlap. You want to learn how to hinge like a door hinge rather than curve forward with your spine. It's about where you're bending from in the midsection. And so your spine ideally would be more straight, and you're ideally connecting to your core engagement, or your anchors, if you think about it that way, and keeping that spine supported. And then all that hinge goes at the hips. It's going to take effort. It's going to take core engagement to achieve stability. And you might want to just try and help that along with the stabilization exercises that you do, either prone or, supine on your back anchor connection, breathing, maybe bridging a little bit to help support this vulnerable region of the spine here. As you can see, just looking at our bony structure, it's super prone to instability because there's no bones around it to stabilize it like the thoracic spine has, or like the pelvis has. So activating these muscles might be the best thing for you right now, and just activating them and getting them as strong as you can. The approach that I believe in this program is we're going to want to use the core as a synergistic group of muscles. They work together as a team, and they kind of need each other to be able to accomplish the ultimate goal. The transverse abdominis is this deepest muscle right here. And then we have actually 3 other layers of muscle. And this would be the internal oblique, the external oblique, and then the power muscle. This is the muscle that actually performs movement, like a sit-up type motion or curling up. Say you're laying flat on your back in bed and you need to get into the sitting position. You're going to be using mainly this muscle. It's a movement muscle. This is the one muscle that I do tend to kind of separate from the group of stabilizers. So these 3 muscles are all, if you look at their broad design, they are shaped like a corset brace, which is exactly the most effective type of back brace that we use to support the spine. So that's the design of these muscles, primarily to support the spine, where we do not have bony support. We don't have a rib cage in this region. We don't have a pelvis in this region. It is more or less a very vulnerable section of the body to injury, because if the muscle group that we're talking about is not active, it doesn't have inherent structural or bony support, like the areas of the thoracic spine above or the sacrum down below or the pelvic region. Just to clarify, we don't want to just separate the transverse abdominis. It works together. This is my view, with all the muscles to just create this supportive brace of the spine. And so there is no reason to be thinking about the transverse abdominis or if it's active or not when doing the exercises, because we just want to make sure that all of our core is turned on. So we're trying to activate all of these guys in the program. So exercise to focus on would be hip hinge and deadlift. And the bridge is the introduction to the hip hinge. And it strengthens the same muscles that are going to help you hip hinge and deadlift better, because this is the motion that is going to spare your lower back in your daily life. You want to learn how to hinge like a door hinge rather than curve forward with your spine. And the muscles are going to automatically engage to achieve that intention without you having to say engage or override your software programming for when muscles contract and when they don't. Because we can compare this just to the same way you reach for your glass of water. You don't tell every individual muscle in your hand and forearm to engage or disengage. You have the intention to reach for the glass of water, and the muscles do it automatically. That's what we want to train our core to do with movement of our entire body. We're starting at the absolute basics, which is infant development. This is a technique that's been proven by nature, right? I didn't invent this. This is how you originally developed your core as an infant. And you likely did that successfully without ever learning what a muscle was or what it means to engage a muscle. You just had the simple intention. And the way that happened, it was your intention was to get up off the ground, and you were pushing away from these areas of our body that we've named the back anchor. Basically, with SI joint problems and pain, it's not just, and lower back pain too. This is a universal truth for any injury, but especially SI joint pain is very easy to make this mistake. It's not just about doing the right things and doing good exercises, but it's also about eliminating the things that are bad for the injury or really stress the injury. So for example, you sprain your knee or your ankle. You're going to go to physical therapy and do the right things, but you're also going to avoid certain things like that are going to hurt your knee or your ankle. Like you're not going to go play basketball, right? Well, those are pretty obvious things for knees and ankles, but SI joint, right in the middle of your body, right deep in your pelvis, you can't even really feel it. We don't even really feel our SI joint unless it's in pain. There's very low body awareness of the SI joint, right? It's not like our shoulder joint. So the activities that irritate that joint are like a little bit of an enigma, and we don't really fully understand it or know what it is. And these are things that could easily set you back. And so that's what it sounds like. Just some brief examples of activities that really stress the SI joint that you should avoid are deep squats. Also, a lot of like asymmetrical activities, a lot of hip flexor strengthening activities are going to do it. So these are just some things. I have multiple YouTube videos on activities to avoid with SI joint pain. So I would check those out for sure. So with that in mind, everyone, I will see you again next week. Make sure to get down on that floor and connect to your core.